The problem was that Southampton have a higher than national average rate of conveyance of non-injured fallers, and it was suggested that this was because of a lack of awareness of the community services provided by Solent. So in response to this risk, a clinician from Urgent Response is now based up at the Scas Control Room in Otterbourne, 5 days a week, Monday to Friday, 8 till 1. And we can see all the jobs that are coming in from Scas, and we can message the ones that we feel like we might be able to help with. The crews then call us on our helpline, and we give them appropriate advice and refer on to the service we feel is most appropriate. So Urgent Response can help with clinical monitoring, short-term care, same-day equipment. We can give them an overview of the information that we know about the patient already, and then we can refer on to the wider health and social care teams if needed. We started in August and initially got ourselves trained up on their systems and familiarised ourselves with the call room setup and how the workings of Scas are, and kind of integrated ourselves within that by talking to as many people in the control room as possible, listening into 999 calls. We made some posters to go up in all of the ambulance control rooms. We made business cards to give out to crews to spread the word as much as possible. Initially it was quite slow to get going. It's been a bit of a change. It's to change of mindset for some of the crews, where maybe they're used to just scooping people up and taking them into hospital. It's asking them to consider ways that we can support the patients at home instead. So far from being there Monday to Friday 8 till 1, we've been involved in avoiding 74 admissions to the acute hospital, which has allowed the patients to remain safe in their own homes, receiving the support that they need. So feedback's really been really good so far. The crews like the responsiveness of the service, and the Urgent Response can attend within 2 hours if appropriate. And through going to the team days, we've been able to really talk to the crews and try and increase their confidence in that the community services will be able to respond to their patients and keep them safe at home. So in the future, we'd like to really increase the joint working that we do with the Scas crews. We've been out with them in the ambulances for a day as observers, but what I'd really like is if we could go out and spend time with them more as educators, and for some of them to come and spend some more time in Urgent Response as well, to really increase their understanding of the way each other works, and really be able to work together to support the patients to stay at home. It's been a bit of a challenge to get out to their team days because there's 15 crews across Southampton, and the team days only happen every 12 weeks, so trying to get a slot on all of them has been a bit of a challenge, but we've now got we've got dates lined up for each of the crews over the next 2 to 3 months, and the CCG are keen to invest further into the service to expand the hours, so we're covering 7 days a week, potentially 8 till 6. So this is a really great opportunity for Solent to showcase the breadth of community services that we've got, and work with Scas in a partnership, having respect for each other's different ways of working, different backgrounds, different values, and understanding that not everybody knows what we know, and the best way to keep patients safe at home.